There are always some hoops to jump through to get insurance to cover. However, some insurance companies are much easier to get breast reductions processed through than others. Some completely exclude it. So, you know, from the beginning, and we try to let ladies know when they call the office if we know that their insurance doesn't cover it so they don't get frustrated, sad, mad, upset in any way. But in general, there's a process. There are a number of check boxes. We go through the list of what kind of pain do you have? What do you do to treat it? Have you been to a chiropractor, a physical therapist, routine massage, acupuncture? There are a number of different treatment options that are considered conservative management. And the insurance companies really need to see that you have exhausted those. You don't have to go to all of them, but have at least tried other things for an extended period of time. And if those people who are doing those treatments can write a note saying that they treated it and that they feel that the area of pain is being exacerbated by the weight of the patient's breasts, if the primary care doc who's been prescribing maybe prescription creams to help treat the rashes, neurologists, different people who have been treating different issues, neurosurgeons sometimes when folks have had surgery on their necks or their upper spine may chime in and recommend a breast reduction to help alleviate that. Sometimes an orthopedic surgeon, if somebody has a shoulder injury and they're trying to get them healed from that or know they're going to need to heal from that, sometimes they'll send somebody in. So there are a number of sort of supporting medical evidence or proof that somebody is not just asking for a breast lift to be covered by insurance, that they actually are carrying around a lot of weight that's causing them problems. And so if we get enough of those folks to chime in, then usually we can get them through, although sometimes it's not successful still. It's always a shame when insurance doesn't cover them, but when it doesn't, I mean, I've seen very small amounts of breast tissue removed and ladies feeling a world different. So even the requirements for insurance don't even necessarily mean that someone won't feel just as great afterwards if we're removing a little less. It's just that it doesn't meet their requirements. I mean, I will say commonly, if it's an insurance reduction, you're going to be removing a pound or more per breast. And so it's a fair bit. Not always. If somebody is based on somebody's overall body frame, if they're particularly petite, it may be a little less, but something in that range per side. We have photos on display at portlandplasticsurgery.com, also on our socials. And if you come into the office at any time, I can show you a list of before and after photos of folks who maybe weren't even comfortable with them being out in social media or out on the computers, but that are really happy with their results and happy to share with prospective patients.